speech is on diabetes. Everyone knows someone or did know someone that has had the disease diabetes. It is very common and extremely hard on a person who has it. It is a nasty disease and consumes a large amount of people every single year, not just in the United States, but worldwide. Diabetes is a disorder in which the blood sugar levels are extremely high. The hormone insulin, which controls the amount of sugar in your blood, is not produced in the amount that it should be. There are 3 different types of this disorder, and all of them together form the group diabetes mellitus. They include pre-diabetes, type 1 diabetes, and finally type 2 diabetes. The pancreas produces the insulin in a person's body. When the sugar is absorbed in the bloodstream, a stimulant is sent to the pancreas to produce insulin to maintain a healthy level of sugar in the blood. Insulin helps aid in the sugar moving from the bloodstream into the cells for energy. When a person eats, they are obviously taking a lot of sugar from their food. This is why there's a large spike in a person's blood sugar level right after they eat, which lasts for about 2 hours. People with diabetes mellitus have to watch their sugar intake, or that spike right after they eat can lead to a lot of serious problems. The lack of sugar getting to the cells and the high sugar level in the blood is the main reason for the life-threatening complications and symptoms. Since the glucose was not absorbed into the cells or used up, it gets removed through a person's urine. This is often called sweet urine. Diabetes is a chronic medical condition. This means it can be maintained and you can live with it, but you live with it for the rest of your life and it will not go away. Diabetes is a Greek word for drain, and mellitus means honey or sweet. This makes sense because people that have diabetes often lose a lot of water from their bodies, and the fluids of their body have a lot of sugar, and they're referring to the honey or sweet terms of mellitus. In some cases, diabetes can have too little of sugar, which causes them to be diabetic. This is still very dangerous and has to be controlled. Diabetes takes control of the lives of about one out of every 20 people. This turns out to be about 12 million Americans every single year. Most people don't even notice that they have it, never go to a doctor to get diagnosed. Overweight people are more susceptible to diabetes. Since there are many overweight people in America, diabetes is the 3rd leading cause of deaths in the United States. Along with this, diabetes leads to many other diseases that can harm a person's body. It is also the main cause of blindness in adults. Around 2 million people yearly have to be hospitalized because of their diabetes. Pre-diabetes is not really considered a type of diabetes, but has a great chance of leading to a type of diabetes. It is said to be where the blood sugar levels are too high to be considered at a normal level, but not high enough to be at the level of type 1 or type 2 diabetes. Doctors take this very serious when a patient has what it takes to be in the pre-diabetes category, because they have a better chance of getting the real diabetes, but with some exercise and healthy eating, they should have no problem with avoiding it. Exercise and healthy eating should be part of everyone's daily life, whether you have the chance of getting a serious condition from it or not. Type 1 is the most severe type of diabetes. People with type 1 cannot produce their own insulin. They have to take injections of it. Type 1 is often referred to as insulin-dependent diabetes because of this. This disease can often be tracked back to another member of the family, and if the family member has it, the person has a greater risk of getting it. Almost all cases of diabetes that take place before the age of 20 are type 1. The cause of lack of insulin in type 1 is that the beta cells are destroyed. Scientists are not exactly sure what causes these cells to die, but the theory is that a viral infection or a nutritional factor can actually cause a person's own immune system to attack and kill these cells. Along with managing the blood sugar level and allowing for the sugar to be absorbed into the cells, insulin also promotes the storage of fat. While there is no insulin, the growth hormone takes over, releasing the fat from the storage and nowhere to go. There's nowhere to go. The cells need these fatty acids for fuel to work. The last resort for the cells are ketones, made from the fatty acids by the liver. But a buildup of these ketones can become harmful to the body with no other type of energy getting to the cells. The liver uses up these ketones and produces them faster than they can be used. Damage to the blood vessels is very realistic with uncontrolled diabetes. The fatty acids aren't absorbed and build up deposits in the vessels. This leads to high blood pressure because the vessels have a lot narrower passage, making the heart work harder. Everyone knows that high blood pressure can lead to a stroke and heart attack, which can be life-threatening. If these are avoided because the entire blood vessel becomes blocked or hardened, that area of the body can actually die from lack of oxygen. These areas must be surgically removed after they die. Diabetes can also damage capillaries. This is where nutrients and oxygen are exchanged and where arteries switch over to veins. Damage to these tiny structures can damage the nerve cells, which can take your sight or your sense away from that area. The most common diabetes in the United States is type 2 and takes account for around 90% of diabetes cases. Very uncommon in young people, but that changes as they age and become overweight when their chance of getting type 2 greatly increase. Like type 1, people with history of type 2 in their family have a lot larger risk of receiving it. Complications with either type of diabetes is very common and unlikely avoidable. There are things people can do to reduce the complications, like exercising. As mentioned earlier, the main complication with diabetes is with the blood vessels.